National Spinal Injury and Referral Hospital offers specialized healthcare services to patients with spinal cord injuries in Kenya. The core function of this hospital is to rehabilitate patients with spinal cord injury. This facility was founded in 1944 as a facility to take care of soldiers at Second World War who had spinal cord injury. At that time, it was called Amani Chezire Home. This structure was then donated to the government in 1963 by Amani Chezire after independence, and became to be known as National Spinal Injury Hospital, which is put under the management of Kenyatta National Hospital by then. National Spinal Injury and Referral Hospital has several departments. One, physiotherapy department, which entails the usage of exercises and machines to do exercise strengthening for the patients who had spinal cord injury, depending on which level and the impact of the injury to the spinal cord. Occupational therapy as a component of rehabilitation, it entails with the fabrication of machines or planes for functioning abilities of the patient. And depending on which level the patient has been affected, now the occupational therapy comes with a model of exercises and equipments to aid the patient to go back to his or her original being in doing activities. Mental health and social work is very important for a patient who have spinal cord injuries, in the sense of accepting the situation of the patient and in reality of the outcome of the disability. Now, in the mental and health department and social work, we have the psychiatrist on board, we have psychologist, we have medical social worker and psychologist. In dental department, we have several machines in the aspect of curative, preventive and promotive to deal with the oral care for the patient. Nutrition department plays a key role. They deal with taking care of the patient in the nutritional status. The nutrition will focus on the major component of food. That is the proteins. We have carbohydrates, we have starch, we have minerals and water. All these components are being directed by the nutrition department, and it has officers who are able to analyze the patient needs so that they can be given according to their needs. Pharmacy department is very key in the sense that when the patient comes for rehabilitation, this patient will need drugs for pain management, drugs for infection control or management of infections if the patient have wounds. So the department plays a key role in giving the drugs which are necessary to enable the patient heal well in this process of rehabilitation. Laboratory department is very key to ensure that the patients are able to take care of any analyticals that are needed. Now, this department will carry out the biochemistry, will carry out the hematology, will do the parasitology, will do serology, immunohematology. This department will also do the microbiology and immunology. In theatre, we have sophisticated machines taking care of surgeries for the aspect of either plastic surgery or spine injury surgeries. We also have in theatre, the machines are able to do the spine fixation, the patients who need spinal stabilization and fixation. Also do orthopedic surgeons will also do the total hip replacements and knee replacements in the aspect of the need of the patient. In radiology department, which is very key department for diagnostic, we have MRI scans, we have CT scans, we have ultrasound scans, and we have X-rays. National Spinal Injury Referral Hospital, it is the only spinal cord and injury rehabilitation hospital in East and Central Africa. For all those cases who have spinal injury, we welcome you to come and be the partaker of these services in this prime institution. It outstands to be a quality provider of healthcare services, not limited to spinal cord injury, but it also does other treatments needs for the patients in our locality.